Welcome, everyone. I want to talk about the skin today. We're going to talk about restoring the skin with cannabidiol. I'll talk about a number of different approaches where cannabidiol can really enhance our skin condition and prevent and treat many different diseases. I'm going to talk about the burden of disease in skin conditions, as well as conventional treatment, the endocannabinoid deficiency that's so common in so many different conditions that we encounter, evidence for CBD's benefits, serving sizes and management for skin conditions, and I'll have a time period for questions and answers at the end. What we're going to be talking about today it'll focus a great deal on acne, but here are some of the other conditions that we're going to encounter with skin conditions and that cannabidiol could play a major role. Rashes, infections, scarring, psoriasis, cancer. All of these are very pertinent and they create quite a bit of a burden of disease. I'm not going to go into many other diseases because we just don't have the time, and I think that the topic of acne will really explain quite a bit about the mechanisms of action for cannabidiol and how it does its work. Now, you may be surprised that skin diseases are hugely expensive, and in our country, we're spending $75 billion towards the expenses and the costs of skin diseases, and 85 million people are affected. It's said that perhaps 1 in 3 and 1 in 4 of us actually has a serious condition that has to be controlled at some point or another with a dermatologist, and the potential for some disruption of our skin in a major way. There's quite a bit of disability and impairment related to skin conditions as well. We don't think of it in terms of the simple rash that occurs, but for people with major problems, things like psoriasis, this can result in social isolation as well as employment opportunities that could be affected. Certainly, we've got many things that are effective for psoriasis, but there are a lot of other conditions. Rosacea is another one with the reddening of the skin of the face. Of course, acne is one that's a perennial problem for people of all ages, as a matter of fact. Now, it may not be recognized that this is actually a global issue. Now, the global problems tend to be working on the issues of scabies and some other infectious elements that go on with skin diseases and throughout the world, and different types of conditions that can affect almost anybody in any country. So we don't think of this as just being the developed world. It certainly has a much broader range of effects on so many people. Now, just a little bit of the basics here I want to go over. We're going to talk about the skin, and this is not really the proliferative phase of wounds. We're really talking about the skin here, and I wanted to show you a diagram that demonstrates the epidermis as well as the dermis. So the epidermis is that highly protective layer that protects us and is that shell that keeps us from being injured and letting out many of the fluids that we have inside our skin. And then the dermis is composed of many of the structural components, the organs of the skin, including the nerves, the vasculature, and in particular, one of the areas that I'm going to be focusing on, particularly for acne, is the hair follicle and the associated seborrheic glands that are there, because this is the target area for acne and where much of the problems with acne and many diseases as a matter of fact, that we'll be discussing. It also has a great relationship to the hair follicle and the quality of the hair and how we maintain our hair. So it has a lot of applications, and we want to go over some of those. Now, a lot of the problems that we encounter with the skin are related to inflammation. I see this so commonly that even with minor infections, that if inflammation develops extensively, then that can cause a great deal of irritation, quite a bit of pain, itching, burning, and very uncomfortable situation for us all. Now, mainly that's working through the macrophages that invade the skin when there is an inflammatory condition. Even things like poison ivy or exposure or hives, you're getting a range of macrophages or other immune cells that go into the area, and they're releasing inflammatory cytokines that can produce a number of problems. And so I've listed a number of these off here. We'll be focusing on interleukin 1, interleukin 6, and tumor necrosis factor alpha. These are the big players in many of the diseases that we'll be talking about a little further on. Now, the endocannabinoid system can be disrupted, and we know that's true for PTSD, cystic fibrosis, multiple sclerosis, dementia, a number of other types of problems. But even in the skin, there is a major disruption that is occurring in the endocannabinoid system that is a big part of the disease process, and getting that balanced is going to be very important. So all of these conditions tend to be what we call clinical endocannabinoid deficiencies, because there is a variation either in the receptors or the agonists, the molecules that are affecting those receptors, or one of the intermediate compounds, whether it's the enzymes or the metabolites of the endocannabinoid system. One of these areas is having difficulty, and we see that in the skin as a result of whether it's diet related or it's exposure to toxic substances and irritating substances, infection, or other disease processes like autoimmune diseases that we may develop. We've got evidence for dysfunction in the skin with a few articles that I've noted here, where the inhibition of human hair follicle growth by the cannabinoids and the skin in health and disease, a full perspective, as well as endocannabinoids, the evidence for modulating the amount and number of cells that are being produced. And this is particularly important with respect to psoriasis and some of those excessive proliferative type of conditions. If we're looking at CBD action overall, what we see with cannabidiol in a global sense, not just in the skin, but it also applies here, we're seeing that cannabidiol has neuroregulatory effects on the synapses where the nerves come together, as well as immunomodulation. So in this case, we're talking about the immune cells, which ones are activated, as well as the cytokines that are being released, and the numbers of cells which will recruit macrophages, as well as stop infection. Hormonal effects of the cannabidiol are also very important. We tend to overlook these in most cases, and including the skin, but a lot of this has to do with the effects on hunger, on stress, on the sex hormones. And this has an important role in skin diseases, because we know that testosterone has an adverse effect on the skin in terms of promoting certain types of conditions, especially acne. So this is very much relevant even in this skin condition. We're also seeing that cannabidiol prevents oxidative stress on the cells. So that preserves cells, it protects them from damage and destruction, whether that's from trauma or it's a chemical or even chemotherapy or radiation or sunburn as well. In addition, cannabidiol, to all of these other things, it restores the endocannabinoid system. We've got really good evidence where the cannabidiol's action within the endocannabinoid system raises the levels of and balances the levels of the receptors as well as the endocannabinoid substances to a balanced level. And I really like to emphasize the balanced level. It's not pushing it in one direction or another. It's balancing it, keeping it at a level and a functional basis, but restoring that. And whenever you have to restore the endocannabinoid system, you have to remember that there are needs for other substances, good health and good nutrition, particularly omega-3 substances. Cannabidiol on the immune modulation is reducing the number of macrophages. It's stopping the recruitment of these particular cell types, as well as decreasing the pro-inflammatory cytokines, such as tumor necrosis factor, interleukin-1, interleukin-6, and a host of others. At the same time, and this is the smart molecule that CBD is, it is increasing the anti-inflammatory cytokines, the IL-4s and the IL-10s, which are very, very important in regulating the triggers for cellular action within the body. And at the same time as it's regulating this immune system, it's not putting it in a state where anyone is going to be susceptible to infection. Those particular cell types that are going to be incorporated in any type of invasion or infection are going to have their normal activity, and they have their normal protection that they offer the body. With respect to acne, this is a fascinating type of problem, and I think it's an excellent example of endocannabinoid system dysfunction. Because when you take cannabidiol specifically, we see cannabidiol working on areas of in the skin that are signaled in the wrong way by the endocannabinoid system. Anandamide, which is the most prominent and we hear about as the most prominent of the endocannabinoids, actually has an inflammatory capability for the skin. It can increase the susceptibility and the development of acneiform type of rashes and lesions. And regulating the AEA or anandamide can be very important. What we've found in cannabidiol is that it works at 3 different sites to regulate the sebaceous cell, which is very, very important in this whole process of acne. I mean, that's what it comes down to, is the sebaceous cell has this dysfunction. Cannabidiol is working at 3 different levels. It's stopping the inflammatory type of lipids, fats that are released, arachidonic acid, which is inflammatory and produces quite a bit of irritation. In addition, it's stopping the extra production of cell types that are involved in the sebaceous cell that lead to plugging, as well as the over production of sebaceous material and those lipids. And at the same time, it's providing that world-famous anti-inflammatory effect in reducing the inflammation. The mechanisms that are involved with cannabidiol doing this on the sebaceous cells are really quite amazing and comprehensive. They're dealing with a number of detailed pathways, so much so that this particular author of this article produced this diagram, calls this the anti-acne trinity of cannabidiol and the mechanisms that they discovered in this process. Cannabidiol is a universal anti-acne agent. It possesses a unique triple anti-acne profile. Now we're looking at the sebaceous gland on the left, where we're seeing that connected to the hair shaft, and it's releasing its sebaceous oils, not only for lubrication of the skin and protection of the skin, but also for the hair. So it's very carefully and closely involved with hair health as well. And I think that's something important to keep in mind. There are other unique pathways for cannabidiol within the sebaceous gland and all of this process. One of the most unusual, I think, is the antimicrobial peptide that cannabidiol actually induces and is produced by the sebaceous gland. In addition, here's again the logic of cannabidiol in working with the body and balancing and maintaining homeostasis rather than pushing in one direction or another. When they looked at the genetic profile and which genes were being activated, upregulated and downregulated, they found an almost balanced approach where 80 genes were being downregulated by cannabidiol, and 72 were being upregulated. So you're really getting a tuning up of the body and the tuning of function. And that's a characteristic that I see consistently with cannabidiol, where it's regulating the body, it's balancing it, it's maintaining homeostasis, rather than causing one effect or another effect, as we would see in many medications that are being used. Cannabidiol reduces the amount of lipids that are being produced. On the right, I show you one of the glands and the structure where you have the cells lining it. The small particles that are small red dots there are actually particles of lipid that are being released into the cell lumen, and then there are loss of cells that are coming out of that area. There's quite a bit of cellular activity in these glands where these cells have to be replaced on a continuing basis, so that cannabidiol is working on the lipid production, on those inflammatory fatty substances that get onto our skin. It's reducing the actual cell numbers at the base of the gland. So by limiting the cells, then it's going to reduce the amount of sebum and oils and inflammatory substances that need to be produced. But as we spoke about before, it's not reducing them down to too low a level. It is balancing it, it's normalizing it, it's preventing that hyper situation that we see in acne and other diseases. It blocks the keratin plugs that form the blackheads, the pimples that are forming. It allows those cells to be released and to have a continuing flow of sebum. And it inhibits the bacteria that is most significant for causing acne and being involved with acne. In addition, very uniquely, cannabidiol is blocking the effects of testosterone. So you're getting the benefits, you're blocking those particular hyper effects that testosterone can induce, and those extra secretions, as well as the extra cell production that's going on. A rather unique aspect, I think, for cannabidiol and its wide range of effects on this skin condition. Now, this is probably the worst kind of acne that you could imagine. It's not actually acne, it's actually affecting the apocrine glands in under our arms, in our genital area, around the perineum, under our breasts. So these are inflamed and irritated glandular structures, and they produce sterile abscesses. It appears to be an autoimmune disease, and it has very poor healing. And it's associated with quite a number of problems in terms of quite a pain, depression, and disfiguring. But here's an important point, that as many as 13% of people with inflammatory bowel disease have this condition. Why? Because it appears that one of the inciting substances, the cytokine that's closely involved with this, is tumor necrosis factor. And in fact, anti-tumor necrosis factor drugs have been quite effective in controlling this particular problem. Another condition that we hear of often is psoriasis. Now, psoriasis actually has to do with the epidermal layer, where the cells are being produced at such a high rate every 5 to 7 days that the cell turnover is occurring. So it's very rapid, and there is a hyper response. This is also an autoimmune type of problem, most likely. And there are signs of a pathogenic type of cytokine called interleukin-17 that is involved with this condition. Once again, anti-tumor necrosis factor drugs are being used in that, injectables and pills that work on these conditions, but they are not entirely satisfactory. Only 35% of people actually gets relief. I show you a case of this woman who I was working with about 2 years ago and had a clearing of her condition. But the cannabidiol went much farther than just clearing up the skin. it really changed her life in a number of ways. She was a voice teacher. She is a voice teacher, and it improved her voice. It improved so many different aspects of her health that she started some new business ventures. She's maintains clarity, and she's had no further exacerbations of her skin condition as long as she maintains the cannabidiol at a low level, not requiring high doses that you might expect from a severe condition. And finally, we can't leave this topic without addressing cancer. Here's an example of a basal cell cancer in a 50-year-old man that was a recurrence of a cancer that was actually removed about 6 months prior to that. The elixinol was applied under a Band-Aid on a daily basis, and he had complete healing within 2 months without any signs or of any difficulty, and with a complete clearing, again, without any recurrence, but he's not had to continue using cannabidiol in this particular case. Other types of cancers, it's very likely that cannabidiol could play a major role in preventing as well as treating malignant type of cells that form in the skin. So let's go over some of these things a little bit. Remember that cannabidiol comes from cannabis, but there's really two types of cannabis, the marijuana and the hemp. The industrial hemp doesn't really contain any significant amounts of THC. And so CBD is from hemp, and it's really focused on improving health. It's safe, it's legal, and it's effective for a wide range of conditions. I would say the efficacy is on the order of 75% of individuals who are having difficulty of any kind are going to get benefits from using cannabidiol. There's no significant reactions or toxicity and no significant interactions with other substances. And above all, it's going to restore the endocannabinoid system, get people back in balance so they can return to health in this process. When I'm using cannabidiol for skin disorders, I think in terms of oral as well as topical. For the oral dose, I'm looking for a 15 milligrams twice a day as my standard starting dose, and adjusting, increasing it or decreasing it depend on the response. I would like to increase to the point where people are seeing the benefits of using CBD as well as making changes in their primary symptoms. It certainly comes in capsules, in oil tinctures, and in the liposomes, and all of these can be used both orally, they can be used orally. In addition, the oil and the liposomes can be used topically. I set a target dose of 60 milligrams for some of these more serious conditions to get a control of them and give patients the confidence that this is working for their condition. If we're talking topical, then the oils or the liposomes can go directly on the lesion, and it doesn't have to be a large volume. It can be only 1 or 2 drops, and it's best if it doesn't get wiped off. So you may want to put it under something like a Band-Aid or a piece of plastic to get it to drive into the tissue and the skin that's there. Who should be using cannabidiol? Certainly people who have symptoms that have been unresponsive and that there is a high risk for major difficulties that are going to occur. If there's an impaired organ system and people are at risk for exposure to some of the other drugs that might be involved, other types of things that cannabidiol could be effective for and is effective for, I know wounds, rosacea, shingles, and decubitus ulcers from diabetes. All of these can be helped enormously by using cannabidiol. Let's go over some of these just very quickly. We've talked about this huge burden of skin diseases and the endocannabinoid deficiency that's common in this condition, as well as so many of the diseases that we are faced with as a developed and undeveloped nations. CBD addresses the critical pathways that are involved with so many of these disease states. It's supported by preclinical studies and in practice, and I've given you a number of examples of cases that I've been involved with. No adversities, And the doses are actually quite modest, but with fast results. So I've taken some of the information and the references for this presentation. I've put it into a reference folder on Google Drive. Here's the address for it. It's open and for me to share this with you or interested parties. There is a copy of all the slides that I've produced here, as well as a number of white papers that I've produced on different conditions that I thought you might be interested in. Above the references are a number of links that may help you in your research and learning more about cannabidiol. Well, it's been a pleasure to talk to you about this and for me to go into a great deal of depth about skin disorders so that I can know more and guide my patients as well as the medical professionals that are out there about the role that cannabidiol could play in a number of different skin problems.